what happens is every time you go and sit before parliamentary committees, you do public participation, you do ABC, but at the end of the day, the bill, when it comes out, looks exactly like it was going in, right? So there's a lecturer at Strathmore Business School who came to give a talk from Harvard, and we gave him the discussion once, and the usual thing of Kenyans saying politics is a dirty game, our leaders are doing ABC, and so on and so forth. And he listened to us, and then in the not so politically correct words, you can imagine the exact wording he used. He said, can you Kenyans just quit complaining all the time? You've got so many smart people amongst you. And what do? You step back and let the idiots run the show. He said, I can tell you one secret. You cannot change anything if you're not in office. Do what you need to do to get into office, then do all those good things you're talking about. That's why I've got a lot of respect for Brian, because he took a dive, which is not usual for doctors, by the way, to go into those political circles. My approach was slightly different. When the politicians were doing their campaign period and they asked for feedback from stakeholders like us, the association I represented at that time did not even think we should go and talk to them. All right? And I'm saying, for example, for the current administration, a lot of the time people didn't think they even had a shot in terms of being in office. And my position was, one of these two teams is going to be in office. Our issues need to be on the table. So, if the other team also calls us, we will go. So I went literally against the wishes of my association at that time, and I said, I'm going to say my bit, isn't it? And that is how I went and talked for 45 minutes on all the healthcare policy issues that I thought needed to change. All right? That is why I'm here today. It's not because I had any political influence, all right? You know, there's some shareholders register that goes around. I'm not on that one. Okay? But that's why I'm saying things don't just happen, they are caused to happen. So that is my message, especially for those of us in the health sector at the moment. You have got to position yourself anytime there's change. You remember, for example, when we talked about the Health Services Commission many years ago, when the Constitution was being written, the doctors were busy treating patients. And when the legislation came out, there was no Health Services Commission. And we've been trying to fight that for the last, I don't know how long. That ship has sailed, because I don't even know if there's a way in which we can reverse that legislation at the moment. So it is proactivity, and that's why I'm saying, even for these acts that we have got in place now, that ship has sailed. Let's not be thinking about NHIF. NHIF is gone. Can we play our role in terms of giving our input? And that's why I say, even for some of the associations who have got a seat on the board and I had to take them, we're making policy decisions without them. They cannot come and join later and now complain and say, you know what, our participation, you had an opportunity to do it. And that's what I've said. More importantly, let us play our part. Now, why is this current initiative aligned with the current administration? You know, with this, the bottom-up economic transformation agenda. And it is an economic transformation agenda. So you must remember, primarily, healthcare is not center stage there. Healthcare comes in only because health is an enabler for economic transformation. You know, without health, also the rights are indispensable. You can't talk about freedom of expression and freedom to demonstrate and so on if you are unhealthy. So, but more importantly, economic transformation again has got an impact on our health, because economic transformation is going to have an impact on the social determinants of health. You know, there's that saying that poverty is bad for your health, isn't it? There's bidirectional causality between poverty and ill health. Because of the various, because of the various deprivations that people have when you're poor, it translates into adverse health outcomes. So these are disproportionately concentrated amongst the poor. So those two are aligned in that sense. So what policy proposals came up to sort out the problems we had? First of all, we need to strengthen primary health care. As teaching time saves 9, and even in healthcare,
we'll decide based on the interactions today. We'll decide as to whether the notice that we issued to the NHIF still is in place, or whether providers want to have a different consideration. As at this morning, what we have is a good working relationship between the private sector and the Ministry of Health and the Social Health Authority. So what I can say is, as an association, we are still in talks. We are still in talks. We have a lot of commitment, and as you can see, a lot of commitment from the highest levels of government. But essentially, providers probably need to see a bit more. They need to see a plan for settling the bills, a plan for payment, and we will be discussing that during our AGM in the afternoon. And the resolution that comes from that AGM will be binding on the members. So as it is this morning, the notice is still in place. The purpose of this meeting is actually to see whether we can have a different way forward. Some of the figures are public. We know that, and I hesitate to speak with the chairman here, but I think they have been very transparent. On the books of the Social Health Authority, it's a figure like 22 billion outstanding. We would like that entire figure settled before the Social Health Authority takes over. And if you look at the timelines we are talking about 30th of June. So what we need is commitment from the government, that is the National Treasury essentially, to settle these outstanding liabilities of NHIF by June. We want the Social Health Authority to start on a clean slate. We do not want the Social Health Authority to carry forward historical debt from NHIF.
The petitions that you laid before, the day the regulations were being presented, like for instance, exact timeline for the payment of the claims. We had to also, are you sure that they are going to be included in the SHA or SHIF?
I don't know. Chairman, do we have timelines? What I know for sure is that there is commitment, and I think we're on the same page, that before the transition is over, the settlement of claims must happen. But a lot of providers have gone for many months without substantial payment. So what we as an association are asking for is some sort of immediate relief that is substantive. Now, immediate relief that is substantive, maybe 50%, maybe 60%, that is subject to our AGM this evening. And whatever resolution comes out of that, we will be happy to communicate to the authority and say, even as you negotiate and you talk to National Treasury on our behalf, really, this is really the minimum we can accept to alleviate the pressure that is there in the health system. Yes.
So when should we expect this, so that at least we are sure that patients are going to get treatment from the private hospitals?
We can expect it the way we expect the exam of Christ. In other words, remain hopeful.
They are covered by a private insurer, an organization that we're not very sure about. And on top of it, you're all aware that the organization has been covering the teachers and the police for over 10 years. So we wonder whether there's competitive.
Under NHIF, as I mentioned earlier in my speech, they have got a lot of so-called enhanced schemes. An enhanced scheme implies that you have got an employer, for example, deciding to get additional benefits over and above the package that was being offered in the national scheme of NHIF. So the new act as it is shackles us in terms of we are not going to be running enhanced schemes. So that is because we want a standard package which we can communicate, which will be the same for everyone. So there will be one benefits package. So as it is now, the police, as you mentioned, and so on, are not with the National Health Insurance Fund, and going forward there will be no enhanced scheme. So anybody looking for an enhanced scheme will have to procure those services through a different insurance provider.
together with the regulatory authority, the Kenya Medical Professionals Statistics Council.
Thank you for that question.